Provinces, for the most part, run all of healthcare. They get most of their funding from their internal operations, provincial taxes, stuff like that. But then they get about a 20 to 30% top up every year from the Canadian government called the Canada Health Transfer. To get the Canada Health Transfer, you have to adhere to the Canada Health Act. You have to have public administration, comprehensiveness, universality, portability, and accessibility. Essentially, it makes it so that anywhere you go in Canada, it should be very simple and easy to use the public system that we have. Sometimes, provinces go against the Canada Health Act. So Alberta recently tried to charge people that should have been covered and protected by the Canada Health Act. We actually had some of our funding withheld. We had about 20% of our health funding withheld because we went against the Canada Health Act. We've recently reversed course and we stopped charging. However, if you're reading the news and seeing the news,
Alberta wants to give its doctors the ability to work for private and public healthcare at the same time.
Well, I think you need to have a conservative vision for what you're going to do with the government spending. And our conservative vision is very different than the progressive vision. Because I want to apply principles that I know work in the private sector to how we deliver government services.
Alberta seems to be going towards more of a mixed health model. They seem to be going for a public-private healthcare model, but we're also seeing in other areas that Alberta is passing legislation to increase the provincial political power, essentially. So it'll be interesting to see the future of our healthcare system, specifically in Alberta, and how that relates to adhering to the Canada Health Act, and the future of our health transfers, how that would look. They also use our First Nations numbers in the allocation of funds with the Canada Health Transfer. Population plays a role in the amount of money that will be topped up. So there's a lot of talk with how are we there at the table, because currently they just give the money to the province, to Alberta Health, and it's up to them to allocate it how they see fit, which is something concerning, especially when it comes to free, prior, and informed consent. Do we have a say into where this money goes in the province if they're using our numbers? It's just something to think about.